I find medical news everywhere. Don't be afraid to ask a lot of questions. Don't be afraid to be obnoxious about it.
We need journalists to master the medical beat because medical misinformation is arguably the greatest single risk factor for ill health and disability now in the United States.
Effective medical news communication is vital to our national health.
How are our vaccination rates right now?
Well, according to the CDC, they are not nearly high enough.
Are we better at caring for patients that are critically ill?
I think we're much better.
I'm Erika Edwards. I'm a health reporter for NBC News.
My name is Dr. Vin Gupta. I'm a practicing pulmonologist and an NBC medical analyst. Here's what you need to know about the medical beat. Trustworthy health journalism is the difference between staying out of the hospital, living a long, healthy life, or ending up in the hospital. You, as the journalist on the medical beat, have a real public service, a real calling to what you're doing.
What is the difference and how are they treated?
Morgan, this is a source of a lot of confusion.
It's really critical if you're an aspiring journalist on the medical beat to focus on what matters for your viewers.
There is a delicate balance when it comes to reporting really exciting findings that might not have any real-world impact for years.
Focus on stories for which there's an actionable insight for somebody that's viewing it on the other side of the screen. There's so many interesting potential stories on drugs that will never reach, for example, somebody that might be viewing this segment because it's too expensive or it's many years away from actually commercialization. Focus in on what matters to the largest denominator of people.
I get my fair share of new companies telling me that they have the latest and greatest technology, and they might, and that is fantastic. What you'll often find, though, is that they might have found a particular gene, but it's still light years away from becoming common practice. And so what I always try to do in those situations is ask the question, when am I going to see this in my clinic? Is it next year? Is it 20 years from now? Might it never happen?
Is this something that's transformational, impactful, that's going to really potentially change the trajectory of their life or significantly impact them?
If you're starting on the medical news beat, you have to know that there is a little bit of math involved. For example, you might have a doctor tell you breathlessly that they've doubled the people they've cured with some new treatment. Then you look at the numbers and you realize it went from 2% to 4%. That's still accurate, they still doubled, but it's really leaving out the vast majority of patients who weren't cured, and that's really where I find the bulk of my questions. That's where I want to dig a little bit deeper. Medical journalists have to ask questions and re-ask questions and then go back and double check again to make sure that they are interpreting those numbers correctly. I've had to go back 3 and 4 times to researchers, doctors, to make sure that I'm really not only understanding what they found, but then translating it effectively to the lay public.
This was ground zero, Harborview, literally Seattle.
Yes.
How scary was that for you?
It was so surreal.
What are some tips to keep your medical beat as approachable as possible, as accessible to your audience as possible? Number 1, don't use jargon.
Talk to me like we just met at a dinner party. Talk to me like I'm your Aunt Marge. How would you tell that person not only what you're finding, but the significance of it? I have teenagers, and I often will talk to them about what I'm learning, what I'm reading. They will ask me questions, and that really gives me some really good insight into the questions that I didn't think to ask. One of the best medical resources I find are peer-reviewed journals.
Go directly to the source.
Pediatrics,
The Journal of the American Medical Association,
The Lancet.
the New England Journal of Medicine.
Those are really great resources, really unbiased resources. Those journals have a group of independent researchers who look at the research coming down the pipeline.
3 to 4, if not more, actual experts in that specific topic.
They try to poke holes in it. They ask those scientists extra questions.
Said it's credible, this is legitimate, this should see the light of day,
They send the papers back for further study.
hence peer review.
That's the gold standard of science. When you're looking through those journals, yes, they can be very dry. However, there are people behind those stories. There are people behind that research, and they generally have real patients who they've been treating for decades. It's really talking with these people, remembering that there are people and real patients behind all of this dry stuff, and that's where I like to dig in. There are a lot of resources to finding the right medical professionals, the right doctors, the right experts.
It is critical that we have the right set of voices. All MDs are not the same. Drill down well beneath just the letters MD, or if we're talking to any type of health cadre, look at their background. If they've subspecialized in a field like gynecology, that's a great individual to highlight for a women's health story. or if they're focused on infectious disease or pulmonary medicine, well gosh, if we have the next pandemic or climate change related impacts, that's the set of specialists that you want to go to for a quotation or to develop a relationship with to understand what you should and should not be talking about.
We go everywhere from the Centers for Disease Control and Prevention to the Food and Drug Administration. We go to all of the major hospitals in the country, the Mayo Clinics, the Cleveland Clinics, the big cancer centers. But honestly, I find that I learn a lot from smaller regional hospitals. I love talking to my local EMTs to see what they're learning. I ask my pharmacist when I go pick up a prescription, what are you seeing? Are people coming in to get their vaccines? The other great resource for medical journalists are these big organizations, these public health organizations, the American Academy of Pediatrics, for example. Great resource for anything kid health related. They can help you find the right doctors who can answer your questions, usually in a very timely manner. Where else is your research going?
A lot of us tested positive. We had the infection. We didn't actually have any symptoms. We didn't have the disease.
We have a very unhealthy society, unfortunately. We've seen life expectancy in the United States decline pretty sharply, worsened by the pandemic over the last decade. There is a significant amount of need in the world today, especially across the United States, from a health lens.
If we've learned one thing from the pandemic, it is that medical journalists are vital to our national health. It became absolutely critical for health journalists who understand how to take complicated science, jargon, and translate that into something that's meaningful for the rest of us.